Welcome back to another exciting Strive sessions. My name is Joey Elkins.
And I'm Valerie Richards.
We are clinical pharmacists at Strive Pharmacy, and we're excited to bring to you a new topic on sports pharmacy today. Before we dive in, we want to make sure that you stick around for the live Q&A at the end of the session.
Yeah, we're excited to talk about this today. The first thing we're going to go through is our disclaimer. So this information is for educational and informational purposes only. It is not medical advice, a health diagnosis, or a treatment recommendation. Always consult your healthcare provider before starting any new medication to determine whether it is appropriate for individual circumstances. Contact your healthcare provider with any questions regarding a medical condition. Compounded medications are specifically prepared for individual patient needs based on a valid prescription, and as such are not reviewed or approved by the U.S. Food and Drug Administration for safety or efficacy. These statements have not been evaluated by the FDA.
So we're going to cover first and foremost just an introduction to sports pharmacy. What is sports pharmacy? Why are we talking about it? We'll dive into prohibited medications list. So if you work with athletes of any sort, that's a very important topic. We'll talk about products of interest, things that we offer here at Strive, and things to look out for with each and every one of those.
Yeah, absolutely. This is kind of an emerging area of pharmacy, and I always thought it was something that would be really cool to do, work for a sports team or something along those lines. We have a really cool job here at Strive, though, as well. But really emerging in sports pharmacy is what pharmacists can contribute to athletes. That goes all the way from younger athletes, we're even talking high school athletes, all the way up to Olympic athletes. So things that pharmacists can do to help support the medical teams are addressing individualized medication regimens, education and insights on banned substances, which Joey's going to talk about today. Optimizing supplement use, which is an interesting topic because a lot of athletes use supplements, and Joey has created a supplement line here at Strive, so we're going to talk about some of those and what to look for when you're looking at supplements. Helping navigate acute and chronic health conditions, offering personalized medication options, also monitoring those health wearables. I know that a lot of people have those. We've got Oura rings, we've got the watches, we've got continuous glucose monitors. So all of those things, the pharmacist can help interpret that data. Supporting medication adherence, so making sure that we're taking them in a timely fashion. I know even travel for athletes can really affect how they do their best work. So, if you're going to Denver and you're taking something that might be affected by altitude or something like that, we can really look into things. And then interdisciplinary collaborations among sports medicine professionals, and even on, MLB or NFL teams or just those professional teams, they have maybe a couple different doctors, and those doctors are prescribing medications, and they might not be talking to each other. And so just making sure that we're looking at the medications as a whole from all the providers that are working with the patient.
Absolutely. This is a really fun, exciting topic. We've been about sports our entire lives, and it's kind of fun to make sure we can optimize your patients, your athletes, not only performance, but also their health. So this is the slide, these two slides that I was talking about that I want to make sure that we pay very close attention to. These are the prohibited medications that athletes should not be taking. Now, there is different categories that we can dive into. The most common one, the most well-known one worldwide is what's called WADA, which is the World Anti-Doping Agency. That it covers most professional athletes, but specifically Olympic athletes. So we're dealing with multiple countries, continents. So WADA has a prohibited list of medications that can't be used by their athletes. So we'll dive into those specifically. It is important to understand what league your athlete or patient is participating in, whether it's college sports with the NCAA or professional sports or even the Olympics, because they all have their different guidelines that we need to follow.
Absolutely. And there may be exceptions to some of these rules. Did you want to talk a little bit about that process?
Yes, so there's what is called a TUE or a therapeutic use exemption. And the reason for that is if your athlete has a legitimate medical condition, they need medications to treat that. And so oftentimes those medications could be on these banned substance lists, but there is a way that they can get around that and they can use the medication and get treatment for their illness. And we'll talk about that a little bit more on this next slide. All right, so this slide shows our common prohibited medications. First and foremost, you'll notice that we have anabolic agents or steroids on there. That's an important one to point out because it is in males and females, right? And there's different levels to that. So testosterone, oxandrolone, also known as Anavar or even nandrolone, are all common anabolic steroids, anabolic agents that we need to watch out for and make sure we're careful with those in our athletes.
Yeah, and on testosterone specifically, I know that we have those levels naturally in our body, so how do they go about realizing if we're taking additional
Yeah,
testosterone?
great point. So as I talked about before, if there is a legitimate medical condition like low testosterone that can be diagnosed as a legitimate medical condition, then there could be a need for testosterone supplementation or adding in testosterone to the patient. They would need to fill out the TUE to make sure that they're going about it correctly. But that's a great question and great point to bring up. Other ones we want to talk about here is our peptide hormones and growth factors. Peptide hormones are very popular right now. So even things like Samorlin or Tesamorlin, those are growth hormone secretagogues. Those are actually banned in most of these agencies that we're talking about here. So be aware of that. That is one that can also use a TUE if you need to get around it. Beta 2 agonist. This one's interesting. So we have salbutamol, which is albuterol, if you've heard of that. It's a popular inhaler. That one is actually measured by a threshold. And the reason for that is if you get too high of a dose of albuterol, it can actually act as an anabolic agent. And so that is why that is a threshold limit there. So if your patient does have respiratory concerns and they need an inhaler, this could be an option to have as long as they stay below that threshold. Different stimulants, amphetamine, methamphetamines. Again, if they have diagnosed ADHD, they can get a TUE for this and be able to use these. They want to be careful using them around competition days because it can cause a lot of different problems. Diuretics, furosemide, different diuretics, those are actually banned because they help things get out of the body quickly. And so if they're trying to hide something, oftentimes they'll take a diuretic to get things out of their system. So they want to be careful
Yeah,
with
masking
those.
agents, yeah.
Exactly. Glucocorticoids. Now, this one's actually very interesting because it depends on the route of administration. So these are very popular to use for joint injections. So a lot of athletes need joint injections. So if it is used in a joint, it's actually perfectly fine. It's okay to use. But if it's used as a systemic route, whether it's IM or sub-Q or oral, then it can cause a lot of problems. It's actually banned. So this it's interesting to note on that, that it's going to depend on the route of administration for whether it's okay or not okay in your athletes. Last but not least, we have cannabinoids or THC. It's often banned in most the agencies. It's kind of a gray area right now, but just be aware that it is technically banned in most of those agencies.
Yeah, absolutely. One of the main things we want to talk about with athletes is pain and inflammation, right? A lot of our athletes are practicing all the time. Then we have competitions. And even just as I get older, I have pain and inflammation. So managing the pain and inflammation during training and also helping support that recovery. So common compounded preparations that we can offer at a compounding pharmacy are topical creams. There's different medications that we can put into them. We can also adjust based off of what the provider thinks is necessary for the patient. So some examples, amitriptyline, baclofen, capsaicin, gabapentin, ketamine, ketoprofen, and we can make mixtures of those, whatever you think would be best for your athlete or patient. Like I said, these are applied topically, so wherever that pain, that inflammation is, we would apply it right to that area. We also have benzocaine, lidocaine, tetracaine, which is a little bit of a numbing agent, can help with some pain. So we can also supplement out one of the products with prilocaine. We do have a max load here. The creams can only hold so much percentage of the API or the active pharmaceutical ingredient. So as you're writing these prescriptions, just be aware that there will be a limit of a 34% max active ingredient load. But benzocaine, lidocaine, tetracaine, prilocaine, great for just kind of that numbing, helping the pain there. We can also do a low-dose naltrexone. Now, this is something we have in a flex-dose tablet. While it is not topical, we can do naltrexone topically, but we typically have this in a flex-dose tablet, and it would be something that the patient could take in the evening, help with sleep, which the better sleep you get, the better recovery you get, and can also help with inflammation in the system as well. So those are some of our pain and inflammation options for athletes. And then going straight into wound healing. So I know a lot of athletes, I'm not even an athlete, but just walking around or going on a hike, I tend to get injured somewhere along the way. But some custom topicals to help those recoveries heal, those injuries heal. We have some, we talked about lidocaine a little bit, but phenytoin, misoprostol, gentamicin, aloe vera, we can use these products in creating custom creams for your patients. There has been shown some benefit to these products, whether we use them alone or combined, but mostly you can create that custom that personalized medication for your patient.
Absolutely. Yeah, I've never really thought about wound healing with sports and different things. That's
But
absolutely
don't you get injured?
yeah,
You
no,
play
all the
basketball,
time.
right?
Yeah, it's good to know that there's options out there for our athletes. Next, we're going to talk about recovery support. Now, I think recovery support is very important for our athletes.
Oh, absolutely.
Just as important as training, I think, is it allows the body to get into a state where it can improve each and every day. The first one we're going to talk about here is Samorelin. Now, prior we talked about how Samorelin is considered a banned substance. It is a growth hormone secretagogue, so be aware of that if you're working with professional athletes or Olympic athletes. Anything with the growth hormone secretagogues, Samorelin, Tesamorelin, CJC, Ipamorelin, those would be considered banned substances. So make sure that that is engraved there. Samorelin is fantastic for promoting growth hormone. So if we can support growth hormone, we can maintain bone density, we can maintain muscle mass. It can help with sleep, and sleep is huge for recovery. So that is a great peptide that we can work with as long as it's allowed by the athlete's organization. Next, we'll touch on NAD. Now,
And NAD plus, we've actually had a previous Strive session on. So if you really want to dive deep into that,
yeah. So whether you were in PA school or pharmacy school or NP school, or you probably learned about the Krebs cycle at one point or another.
Nice.
Yes. So NAD plays a huge role in the Krebs cycle. So if you can think back to those days, NAD helps take those electrons and move them over to the electron transport chain and get them out of there. So that can help with oxidative stress. That can help with energy, ATP production. So NAD plays a vital role in our recovery. And so a lot of times as we get older, especially, our NAD stores can start to decline. We want to make sure we have adequate amounts so that we can perform to our optimal levels. Next one, glutathione. Do we have a Strive session?
Yeah, I believe there was a Strive sessions on glutathione as
Another
well.
one you can deep dive
Yeah.
into. So glutathione considered the master antioxidant, so it really helps purify and clean out the blood. That's a great one to learn about. Methylene blue, very similar to NAD and how it works. Studies suggest that NAD and methylene blue may work synergistically to help our ATP production, to our cognitive function, even our energy levels. So those are great for athletes who really need to be dialed in from a cognitive perspective. That can really help give them an edge there.
Yeah, and additionally, these really help with that cellular aging. So if you have aging athletes even, and I hate to say it, but I am aging, everyone's aging, but as we get older, these could be beneficial for that process.
Perfect. All right, so we talked about recovery. Next, we're going to talk about energy and endurance. One important product I want to touch on is L-Carnitine. So L-Carnitine is an amino acid. It helps support fat metabolism. It helps with energy production. It also can help support with cardiovascular and cognitive function. One important note on this is L-Carnitine, as well as glutathione, can cause a kind of a stinging injection. So be aware if your patients are injecting this, they might complain of a kind of a burn when they inject it, which is perfectly normal.
Yeah. We have a lot of people we know that inject it, and we get that complaint quite a bit, but it is absolutely normal for that to happen with those.
Yeah. One thing with energy and endurance we want to talk about is hydration. Oftentimes with hydration comes IVs. A lot of athletes like to get IVs to make sure they stay well hydrated. Different agents that we talked about like NAD and L-Carnitine, those are actually added into many IV bags, just so you're aware. One important note I want to make about IVs, which I didn't know before we prepared this lecture here, is that there's actually a limit for most anti-doping agencies on how much liquid, how much fluid you can get. And it's 100 mLs of fluid or less per 12-hour period.
And that's interesting that you maybe didn't know that because your wife works for an IV clinic,
Very
right?
true,
And
yes.
and she helps athletes recover. So,
Yes.
yeah, that's an interesting talking point for sure.
We did want to dedicate a slide to NAD because it's so popular right now. Everyone's talking about NAD and the importance of it. We offered a couple different routes of administration. We can do nasal sprays, we can do injections. Like we talked about, you can put those injections for IVs as well. So we talked about the popularity of NAD. There's also a lot of NAD precursors that are also very popular. That includes NR and NMN, if you've heard of those. We actually offer an NR supplement in our supplement line. It's called Regen Plus. It has NR, has PQQ and urolithin A, which is really cool metabolic boosting, but that's a different Strive sessions as well.
And that's one of my favorite products that we offer. And you can absolutely use NAD Plus with one of the precursors. So you can use NAD Plus with our Regen Plus. But I think they kind of offer a little bit different benefit that way. But we had kind of discussed NAD Plus a little bit earlier. So
With NAD, if you have athletes who are looking for a kind of a cognitive edge or a little bit of an energy boost, this is definitely the product for them.
the next thing we want to talk about is weight management. And as we get into the next couple slides, we're going to talk about how these are a little bit off the beaten path when we talk about sports pharmacy. What we've kind of talked about up to this point is pretty regular, that we see pain inflammation, we see recovery, we see energy endurance, all of those things. But weight management, and this is a touchy or a gray area type right now. So what is involved in weight management can be those GLP-1 medications that are very, very popular, low-dose naltrexone, lipomino, phentermine-containing combinations. GLP-1 medications can help support, well, they're just finding new evidence all the time that GLP-1s can help support many things. So whether that's insulin function, glucose uptake in skeletal muscle, and glycogen storage. And that can all contribute to energy during exercise. However, this medication is under investigation on that WADA list. So there may be a possibility in the future that it is a banned substance. It is not currently banned, but we do want, as we do with everyone who's on this medication, we want to be very clear that there's counseling points given. We need to watch protein uptake. We need to make sure we're still doing strength training. We need to make sure that we're staying hydrated. There's a lot of things that this medication, once you inject, can cause you to have a little bit of fatigue, or make you not want to exercise as much, or make you not want to eat, and so you're not hitting your protein level. So as athletes, we really need to be aware of that situation. So part of the problem is that this can cause some weight loss. So I think that's why they're investigating these medications for potentially being on that list.
And these are great tools when they're used correctly, right? When they're used with a proper supervision of a provider, they are fantastic options for patients. But we want to make sure we're doing things as they should be.
Absolutely. This continues on to the role of GLP-1 medications in sports. And we've talked about these topics already, but basically those glycemic control, energy efficiency. I know that especially in aging women, we have a hard time with our metabolism. Perimenopause creeps in. This can be a good tool to help with maintaining that weight. But as we also talk about that, we can easily get into hormones.
It's important to note that getting our hormones right is essential for letting us hit our peak performance, especially in our athletes. So we have many different hormones throughout our body. We talked about estrogen a little bit. We talked about testosterone and the roles those play. There are many other hormones in our body that can help achieve our peak performance. One important note is those that come from our thyroid. Those are huge in helping us understand fatigue and weight loss, weight gain. Thyroid can play a big role in that. So want to make sure that we have those numbers dialed in where they should be.
Yeah, and I think that's important in general, right? And I talked about this a little bit earlier, but as women specifically get into perimenopause, menopause ages, it's hormonal chaos in there. So yes, we always want to test thyroid as well when we're doing those tests, but checking the levels of your estrogen and your testosterone and testosterone for men and all of that as we age can really help us align and get specific medications to the patient, to the athlete, to help that peak performance.
And it's important to note that athlete doesn't mean 20-year-old, 30-year-old. Athlete can mean 40-year-old, 50-year-old, 60-year-old.
Absolutely.
And so we don't want to put that in a box to where we're not talking about premenopausal or postmenopausal. We need to make sure we take into account all the factors that are going on in our patients' lives.
Yeah. Next, we're going to talk about something else that is a little off the beaten path. It's the skin and hair health. So something that athletes are exposed to very much, especially if you are playing outdoors. So running, hiking, biking, I think you play outdoor basketball sometimes. You are in the sun, you are in the elements. So, and then even talking about swimmers, surfers, all of that, we are now exposed into water and sun and sweat and all of that. So want to make sure that we're addressing really skin health and of course, sunscreen should be worn. I actually think that I just had a conversation with Joey yesterday about how much he hates sunscreen. So, but sunscreen is very important to address anything where our skin is aging, right? So we know that skin cancers are very prevalent if you've been out in the sun quite a bit. When I was younger, I did a lot of outdoor activity and have started having those conversations with my provider. So the earlier you can start protecting your skin, the better. Always make sure that you have a good routine to apply sunscreen, and then also when you're done in the sun that you are taking off you're following your skincare routine. We also have some healthy aging agents. We have a really nice skincare line that our pharmacists have formulated, and we can include those peptides like GHKCU. We also have antioxidants like vitamin C to help support that. When it comes to hair, you can have those hormone changes that we talked about in the last one. There's a lot of stress when it comes to being an athlete, whether you're an Olympic athlete or whether you're at the high school level. This can contribute to hair loss. So we do have scalp care. We have formulas to help with this. GHKCU we talked about as a topical cream, but we also have it as a hair solution. We also offer different hair management or care options. So whether that be Hair Force One, we have even a supplement called Grow. We have different options, Raven, Cedar, Ivy, which are tablets, and that can just be depending on if you're male or female and where you're at in your health journey.
And I don't know about you, but hair health plays a huge role in my confidence levels. And
You have a great
so,
head of hair.
and that rolls into our ability to perform our best, I think, our confidence levels.
We're going to dive into some supplements here. As I mentioned earlier, Joey has helped formulate our supplement line here at Strive. And so we're going to talk about specific supplements that we offer, and just we'll even talk about supplements that aren't available through us, but how you can find a reputable or what's a good supplement.
Yeah, so we're going to touch on 3 kind of core supplements that I would really be willing to bet that most of your athletes are taking already. The first one is going to be protein, right? What we have here is what's our clear whey protein or clear protein hydration. So I'm sure you've heard of whey protein. It's the most popular protein there is. There's 100 different flavors of whey protein. It's a very fast dissolvable protein, so it's great for after workouts. Clear whey is whey, so you get whey protein from milk, and then you run it through an acidification process and you get a transparent molecule or a clear molecule, and you get clear whey. So it's a much lighter.
Wait, I didn't know that.
Oh yeah, so it's a much lighter liquid, so you don't get that thick kind of chalky taste that you get from a lot of whey proteins. This is more of a juice texture, just kind of an alternative take. It still has 20 grams of protein, so you still get that fast dissolvable protein that you're looking for. It's important to know, as we talked about, we're not trying to sway you one way or another. We want to make sure you're educated on protein sources. So when it comes to protein, it's usually you take 2 routes. It's either it comes from animal or it comes from plant. Those are the 2 different options. And a lot will depend on your patient's preferences. So if they have trouble with dairy, then whey is obviously not a good choice for them because it can cause a lot of upset stomach. So we can look at a plant-based option for them. So just figure out what their needs are and we can find a protein source for them. There's 100 different protein sources out there. We need to make sure we get adequate protein into our daily regimen. In a perfect world, we would get it all from food, right? But most of us need some kind of supplementation to hit our protein goals throughout the day, especially our athletes. They have a much higher protein goal. And so oftentimes we need to supplement with a protein source. So make sure we look for a source that is good quality. So if you look on the back and you can see the ingredients, first of all, if you can read the ingredients, if they're not hidden in a proprietary blend, that's a good sign there. And find brands you trust. We decided to make this Strive supplements because you as providers trust us with your medications. And so we wanted you to trust us with our supplements as well. And so we took that same approach in creating this supplement brand here.
And one thing I want to mention about the protein that we have here is that it is a coconut mojito flavor, which is actually a very good flavor. And it mixes well with a lot of things. I mean, yes, you can mix it with your water, but didn't you make some sort of frozen
Made it
treat?
creamy with it.
Yeah.
And it turned out very, very similar to a key lime pie, actually.
Okay. Yeah. So there's different options there to help people get their protein.
Yeah. Awesome. Next one we'll talk about is probably the most popular supplement out there, and that is creatine, specifically creatine monohydrate. You might have heard of creatine hydrochloride, both good options. Creatine monohydrate is very important in ATP production. So if you think of creatine as a battery source, so if you're working out or if you're running or if you're doing stressful activities, your muscles, your brains can run out of battery very quickly. Creatine can help recharge your muscles, recharge your brain. So we always talk about creatine with muscle growth, right? Which is big, it's very important. But there's a lot of new studies out there on the importance of creatine with brain health and cognitive function.
Yes, I've been reading a lot about that, especially in women, aging
Yes.
women, making sure they get their daily creatine for their cognitive health.
Yeah, so definitely look into that. So if we want to perform our best through our muscles, we will also want to perform our best with our brain, and creatine can help with both of those. When creating this, I was pulling ingredients from literally all over the world to try to find the perfect creatine that would mix really well in water. The biggest issue we get is a lot of creatines become gritty, and we don't like that taste, that texture. And sometimes that can cause us to bloat and GI discomfort. And so I wanted to find a very high quality, a high mesh creatine that would dissolve in the water. And that was our goal with this. It's actually bound to a magnesium bisglycinate molecule, which is really cool, which allows it to dissolve much better. And so you don't get that gritty texture that a lot of people complain about.
Yeah, it's a really nice product. And this one's unflavored. Did we mention that?
Unflavored, yep. So mix it in your juice, mix it in your proteins, whatever you want to mix it in, you won't taste it, which is really good. Last but not least is our cellular hydration, our newest product at Strive, and actually our first NSF certified product. So if you work with athletes, you should know exactly what NSF certification is. But if you don't, it's a very high quality, third party tested organization that not only tests the ingredients in your product, but they also test your labels and they also test your manufacturer. So all those are incorporated into an NSF certification. And it just allows you and your athlete the peace of mind that what they're putting in their body has no banned substances, no matter what organization they're a part of. So that is what NSF is. This is our first NSF certified product, which is huge. I'm very
And
excited
we're
for this
hoping to
one.
get more.
We're getting more.
This is our first one, but we are very passionate about this portion of it to make sure that what we have is safe for your athletes.
Exactly. In fact, the next one that will be NSF certified is our creatine, which you talked about. It doesn't have that certification yet, but it does have informed ingredient certification, which is also very sought after certification, just shows that there's no banned substance. It's a global third-party testing service. So the creatine currently has that. The hydration is our NSF certified product. And like I said, we're going to expand and try to get them all NSF certified so you can use all those with your athletes. This comes in 3 unique flavors. I definitely encourage you to give them a try. The flavors is what really stands out here. But we're just pushing sodium, potassium, magnesium, a little higher magnesium content. It's magnesium bisglycinate, really good for muscle recovery. And something unique here is our taurine. So taurine is an amino acid. Taurine actually works as an osmolyte to help push water and electrolytes into the cells. So this is just a great electrolyte product. You can use it before, during, after exercise. Many of your athletes will be sweating, right? They'll be sweating a lot. And if they do sweat more than normal, they can use up to 2 doses of this, these little individual stick packs, to make sure they have adequate electrolytes in their system.
Yeah, I'm really excited for all these products. I'm excited for this product to launch, and this is, of course, is at this time of this filming. It's just our brand new product, and then, of course, hopefully, we'll get the rest of those NSF certifications, and then we're going to continue to develop supplements, and we'll continue to roll out new products as well. So that is an initiative that Joey is taking on, and we're really excited about it.
So as we close out this session, I think we should reiterate the importance of checking the organization your athletes are in, whether it's with your Olympics or NCAA or professional. Make sure you understand their guidelines, and then you can work off those guidelines to help your patient.
Absolutely. We just have a couple of references here, and then we just want to make sure that you stick around as we transition to the live Q&A. But thank you so much for joining us on this Strive session. Thanks, Joey.
Awesome. Thank you.